Welcome to the EU103 Cyber Series Training Part 2. This training is brought to you by the Education and Development Department. We will explore the cyber platform with a focus on treatment plans. The cyber platform is PerformCare's electronic healthcare record system and is an essential tool for all documentation in our field, ensuring that we keep comprehensive and accurate records for the youth we serve who are referred to us by the New Jersey Children's System of Care known as CSOC. Our goal today is to empower you with the skills needed to effectively navigate this platform. We will examine key elements for creating treatment plans. As we proceed, keep in mind that this information serves as a foundation. Further training can be found under the training link at that bottom of the cyber screens. This will be pointed out later in the Cyber Series trainings. This is an important part of our Cyber Series. Let's start with a quick overview of what we'll cover today. We'll discuss various types of treatment plans, how to connect their components, and the specific timeframes and requirements involved. Finally, we'll go over the cyber instructions. Key point number 1. Understanding the types of treatment plans is crucial as it allows us to tailor our approach to each individual's needs. Key point number 2. Connecting the components of a treatment plan ensures a comprehensive and cohesive strategy, which is essential for effective care delivery. And our third key point. Being aware of the time frames and requirements helps us stay on track and meet all necessary guidelines and deadlines. These elements are fundamental to successfully entering treatment plans within the cyber platform. As we move forward, keep these components in mind. Now, about treatment plans. Let's take a moment to explore what they are and why they hold significance. So, what is a treatment plan? A treatment plan is a structured document found within every youth's file. It's more than just paperwork, it serves as a roadmap for therapy. It details the goals, strategies, and methods agreed upon by both the clinician and the youth. Additionally, it assists in tracking progress and fosters discussions about the treatment journey. When clinicians and youth collaborate to create the plan, it enhances trust and engagement. This partnership establishes a shared path towards symptom reduction and goal achievement. Now, let's discuss how to formulate strong goals, objectives, and interventions. Objectives should be SMART. Specific, what behavior or skill are we focusing on? Measurable, can we monitor progress with clear indicators? Achievable, is the goal realistic for the youth? Relevant, does it align with the youth's overall treatment needs? Time-bound, is there a defined time frame for progress? Example, decrease emotional outbursts from 5 times a week to once a week within 3 months. Interventions, strategies that foster progress. Interventions are the tools we utilize to assist youth in achieving their goals. They should align with the youth's goals and developmental stage, incorporate strategies like skill building, psychoeducation, and behavioral techniques, be youth-centered and culturally responsive, occasionally involve family sessions or community support. So, keep in mind, a treatment plan isn't merely a document, it's a dynamic guide. It evolves alongside the youth and reflects their journey. By building it collaboratively, we create a more robust path to healing and success. Let's dive into the specific responsibilities and requirements for each type of treatment plan. First, for the Behavioral Assistant or BA plan, remember, it must be completed before the BA starts working with the youth. This is crucial to ensure services align with the authorization dates in cyber using the service code H2014TJ. Regular communication with the BA is key to keeping treatment plans updated. Now, on to the IIC or individual plan. This should be completed between the 3rd and 4th session. For renewal plans, they need to be done before the initial plan expires. Be sure to use the correct authorization dates based on the license level using service codes H0036TJU1 or H0036TJU2. Also, it's important to touch base with the care manager 3 weeks before the plan ends to discuss possible transition or extension plans. For the IICPC, or parent coach, the process is similar. Complete the plan between the 3rd and 4th session and ensure renewals are in place before the initial expires. Again, use the appropriate service codes and keep in touch with the care manager as the expiration approaches. Lastly, the IIC Crisis Mobile Response Plan requires completion between the 3rd and 4th session, with a renewal plan due before the initial expires. Communication with the MRSS care manager by week 5 is necessary to discuss transition or extension plans. Submit recommendations by the 5th week. Remember, every authorization must have a matching treatment plan, and accuracy in dates is essential to avoid payment delays. Consistent communication and precise documentation are foundational to successful treatment planning. Now let's walk through 6 key steps that help transform broad therapeutic goals into clear, actionable interventions. Each step builds on the last, creating a cohesive plan that supports client progress and honors their individual strengths. Step 1. Define goals and objectives. We begin by identifying the client's overall therapy goals, what they hope to achieve through treatment. Then, we break those goals down into specific, measurable objectives. For example, if the goal is to improve emotional regulation, the objective might be reduce emotional outbursts from 5 times a week to once a week within 3 months. By defining goals and objectives clearly, we create a roadmap for therapy. This helps guide our decisions and allows us to track progress over time. Step 2. Identify strengths. Once we've established the goals, the next step is to identify the client's strengths. These are the resources, abilities, or supports they already have that can help them move forward. For instance, does the client have strong communication skills? A supportive family? A history of resilience? These strengths will form the foundation of our intervention strategies. Step 3. Develop strategies. Now that we know the client's goals and strengths, we can begin developing strategies. These are broad approaches that use the client's strengths to help them meet their objectives. For example, if the client has a strong family support system, we might include strategies like family therapy sessions or involving caregivers in creating a stable home environment. Strategies should be practical, strengths-based, and tailored to the client's developmental and cultural needs. Step 4. Plan techniques. Next, we translate those strategies into specific techniques. These are the tools we'll use in sessions or between sessions to help the client build skills and make progress. Examples include role-playing social situations, daily journaling to track emotions, or mindfulness exercises. It's important to be clear about how each technique will be used, how often, for how long, and in what setting. For instance, journaling assigned daily for 3 weeks, completed at home. Step 5. Gather client input. Step 5 emphasizes collaboration. We invite the client to review the plan and share their feedback. This ensures the interventions reflect their lived experience, cultural identity, and personal preferences. Some clients may want to include spiritual rituals, while others may prefer group therapy over individual sessions. Their input helps us tailor the plan to their unique needs. Step 6. Implement and review. Finally, we put the plan into action. We deliver the interventions, monitor progress, and make adjustments as needed. Treatment planning is dynamic. We regularly review what's working and revise what's not, to keep the plan relevant and effective. How would you approach revising a treatment plan if an intervention isn't showing the desired results? By following these 6 steps, defining goals, identifying strengths, developing strategies, planning techniques, gathering input, and reviewing progress, we create treatment plans that are structured, responsive, and client-centered. Understanding the timeline and date requirements for treatment plans. Let's explore the timeline and date requirements for treatment plans. This aspect of documentation is crucial. Getting it right ensures that services operate smoothly and payments are processed without delays. Initial treatment plan. Your first treatment plan is due after the 3rd session but before the 4th, typically around 21 days after you begin providing services. Important note. This timeline begins on the day services commence, not the day you receive the referral. Now, here's a key point to emphasize. All treatment plan dates must align with the corresponding authorization dates. If these dates don't match, it may lead to delays in payment for any sessions submitted during that period. Before finalizing your plan, always verify the authorization dates with the care manager. This step is vital to prevent billing issues. Renewals. When a youth or family receives a new authorization, the updated treatment plan must be submitted before the current authorization expires. The start date of the new plan should coincide with the beginning of the new authorization, while the end date must align with the last day of that authorization. Dates are not arbitrary, they must be exact. Quick summary to remember. The initial treatment plan is due after the 3rd session and before the 4th. Use the intake session date for the diagnosis, youth, family vision, and crisis plan. For renewed plans, submit the update before the prior authorization ends. Start and end dates must precisely match the new authorization. Always confirm dates with the care manager. Missing or mismatched treatment plans will delay payment for sessions. By ensuring that your treatment plan dates are consistent with authorizations, you help guarantee uninterrupted services and timely support for the youth and families you serve. Thank you for paying close attention to these details. Such precision truly makes a significant impact. Just a couple of reminders when searching for your youth in cyber. Remember, during your onboarding, you were provided with your login credentials for PerformCare's Cyber. This essential platform serves as the main repository for all documentation related to youths receiving services through C Society. Key reminders. Avoid the administrative section. This part of the platform is designated for agency administrative tasks. Always use the Youth, Child search for inquiries related to clients. The My Active Youth option is not a feature we use. Do not try to look up your families using this link, nothing will generate. Access training resources. For further assistance, training materials are available directly within Cyber. Simply scroll to the bottom of your Cyber screen and click on Training Information. You'll find relevant resources tailored to your user role to help you master this process. When searching for a youth's chart in Cyber, remember that accuracy is key. Refresher from Cyber Series Part 1. Again, don't forget, you want to use the Youth, Child search feature and not My Active Youth. Using the Cyber ID is generally the most reliable way to ensure you're accessing the correct chart. Try to only search by youth first and last name if the Cyber ID is unavailable. After entering your search criteria, click Search to bring you to the Face Sheet, which contains all of the youth's background information. As you scroll down the face sheet, you'll find detailed information about the youth, which is crucial for understanding their needs and planning their care. This step is foundational in managing the youth's record and ensuring that every aspect of their care is documented accurately. As we continue, let's delve into the process of entering an initial treatment plan in the Cyber system. First, you'll want to navigate to the left-hand side of the interface and select Treatment Plans Assessments. This is where you'll choose the type of plan you need to create. When selecting the plan type, remember, if you're handling IIC individual CMO and MRSS cases or IIC parent coaching, you'll choose IIC_2. For a behavioral assistance plan, select BA_2. It's important to note that BA plans are completed by IIC. A behavioral assistance cannot start with the family without the BA treatment plan being updated in Cyber prior to their start. Therefore, it is important that IICs complete the BA plan as soon as it is determined that a BA is needed. Once you've chosen the proper treatment plan type, click Add New to begin inputting the necessary information. Each section outlined must be completed for a comprehensive treatment plan. We will now walk through each section to ensure clarity and precision in your documentation. Let's walk through the process of documenting the demographics and the Youth, Family Vision tabs. First, click on Demographics. Ensure that the start date here matches the intake date. This consistency is crucial for accurate record keeping. Scroll down to the bottom of this section. On the right side, you'll need to update the CFT date and assessment date so they align with the start date of the authorization. This alignment is essential to ensure everything is synchronized with the authorization timeline. Next, move on to the Youth Vision, Family Vision section. Here, you'll want to ensure the start date matches the intake date as well. Remember, the vision should be discussed during that initial appointment, setting a clear path forward for the family and youth. By maintaining these alignments, we ensure that the treatment plan is comprehensive and up-to-date, paving the way for effective interventions. Now let's look at the matrix. This is where we detail the elements of our plan. We need to complete each of these important tabs before you associate them all in the matrix. Complete the follow tabs. The needs, strengths, strategies, techniques, and desired outcomes or goals. Click on Add New whenever you're adding information to each of these tabs. This ensures that all our information is current and accurate. Finally, use the authorization start and end date to keep everything aligned. To change or update any information that has been added previously can be changed by selecting the line that you want to change and double-clicking on it to edit the information. This process might seem detailed, but it ensures that we have a comprehensive view of our plan. Associating elements within the matrix of a treatment plan is a critical process for developing a comprehensive and individualized plan. To begin, open the matrix within the treatment plan. This is the central workspace where all associations are made. The first step is to highlight the identified need, which serves as the foundation of the plan. Once the need is selected, scroll down and click the Associate Strength button. From the list that appears, choose the strength that best supports the identified need and click Associate Strength again to confirm and add it to the matrix. After the strength is associated, the next step is to add a strategy. Highlight the strength you just added, then click the Associate Strategy button. Select a strategy that aligns with both the strength and the need, and click Associate Strategy again to add it to the matrix. With the strategy in place, continue by associating a technique. Highlight the strategy, click Associate Technique, and choose an appropriate technique that supports the strategy. Follow the same steps to add a desired outcome or goal that reflects the intended result of the intervention. This process should be repeated until all relevant tabs are connected, ensuring that the need is linked to the strength, then to the strategy, followed by the technique, and finally to the outcome or goal. It's also important to associate any barriers that may impact progress. Each step contributes to a cohesive and meaningful treatment plan that leverages individual strengths and addresses specific challenges. This is not just about completing a form, it's about building a plan that truly supports the client's growth. For a better visual of how to associate the elements in the matrix, review the steps shown on the screen. Following along with these instructional photos. 1. Highlight the need. Start by selecting the need, then click on Associate Strength. 2. Select the strength. The strengths will appear. Choose the appropriate strength and click on Associate Strength once more. This action will add it to the matrix. 3. Associate Strategy. Next, highlight the strength and click on Associate Strategy. Select the strategy you want, then click on Associate Strategy again to add it to the matrix. 4. Complete the process. Continue this process until all relevant tabs are associated. Make sure to connect the need to the strength, then to the strategy, followed by the technique, and finally to the desired outcome, goal. Don't forget to associate any barriers along the way. So again, be sure to complete the association from the need through the desired outcome, goals. The importance of the Diagnosis tab in your treatment plan. The Diagnosis tab plays a crucial role in your treatment plan, serving as the foundation for what comes next. Here are some key points to keep in mind. For your initial treatment plan, be sure to use the date of the first session where you completed the intake as the date diagnosis rendered. We cannot diagnose a youth prior to meeting them. Diagnosing clinicians must hold full licensure, such as licensed professional counselors, licensed clinical social workers, or licensed marriage and family therapist. The clinical supervisor should be designated as the diagnosing clinician for all licensed social worker, licensed associate counselor, or licensed associate marriage and family therapists. For all renewed or subsequent treatment plans, use the start date of the authorization. This practice ensures both consistency and accuracy in your documentation. By adhering to these guidelines, you will foster clarity and precision in your treatment plans. If you have any questions or need further clarification, please feel free to ask. Now, let's look at the Family Crisis Plan. This section is crucial, and it's mandatory to complete every part. When you're setting up the initial plan, remember to use the intake date as your start date. For the end date, refer to the authorization's end date. Moving on to reauthorized services, you'll need to use the start and end dates from the corresponding authorization. Does everyone feel comfortable with how these timelines should align? Being precise with these details ensures that family plans are both effective and timely. Instructions for completing your documentation. First and foremost, it's crucial to accurately enter your credentials. This step is essential for accessing and managing your treatment plans. Steps to follow. In the first section, input your credentials. The second section is designated for your clinical supervisor, especially important if you are not yet fully licensed. Important: do not fill in your supervisor's information, allow them to complete it themselves. This will serve as their signature on the plan, indicating their approval for submission to the CSA for posting. The licensed date refers to the date you originally obtained your license. When entering the licensure date, keep in mind that this pertains to when you first received your license, not the renewal date. This distinction is vital for maintaining clear and consistent records. There will be a second section for IIC and BA supervisors to add in the licensure information. Do not complete this section. Allow your supervisor to complete it. This is how they confirm that they have reviewed and sign off on the treatment plan. As we move on to the submission or transfer process, let's take a moment to ensure we're clear on the steps. Licensed professional counselors, licensed clinical social workers, and licensed marriage and family therapists should click Submit to forward your plan directly to the CSA in Cyber. Meanwhile, if you're a licensed associate counselor, licensed social worker, or licensed associate marriage and family therapist, you'll need to click Transfer to send your plan to your clinical supervisor. Once you've made the appropriate selection, remember to choose your clinical supervisor from the drop-down menu and then click Accept. After this, simply click OK to finalize the step. These steps ensure that your plan is routed correctly, and it's crucial to follow them accurately to maintain a smooth workflow. Let's walk through the process of downloading a PDF of the Cyber Treatment Plan. This step is crucial to ensure you have a reliable copy, especially if the system's copy feature doesn't work as expected. First, navigate to the treatment plan you wish to download. This is your starting point. Once you've located the correct plan, look for the print button at the bottom of the page. Before you proceed with making any changes or updates, it's advised to download a copy of the current plan. This ensures you have a backup and can reference it during the updating process. To download, select the PDF option to save a PDF copy. Open the treatment plan and select the print option at the bottom. When the report opens, click on the disk icon to save it. This process helps maintain accuracy and ensures you have all necessary documents on hand. It's a simple but effective step in managing treatment plans efficiently. Downloading the PDF version of the Cyber Treatment Plan is crucial for a few reasons. Firstly, it allows providers to share the plan with the youth and their family, ensuring transparency and collaboration. Secondly, having a downloaded copy is essential in case not all information transfers correctly into the renewed service treatment plan. It serves as a reliable backup. Also, behavioral assistants, or BA, should download and adhere to the plan that the Intensive and Community (IIC) provider has developed for them. It's very important to remember to associate all parts of the treatment plan in cyber. For guidance, you can refer to the EU103 Cyber Part 2 Treatment Plan Training. Each tab completed in Cyber appears as its own section in the PDF download, which includes need, strength, strategies, techniques, desired outcome, goals, barriers, and behaviors, which is specific to the BA plan. Let's talk about how to add a treatment plan copy. First, you'll want to open the Copy Treatment Plan tab. This is where you'll find a list of all your previously created treatment plans. Next, click on the plan you wish to copy. Make sure it's highlighted in blue, so you know you've selected the right one. Finally, scroll down and click on Copy Treatment Plan. This action will duplicate the selected plan, making it easy to adjust and reuse. This functionality is designed to save you time. Be sure to update all dates to the current authorization start and end dates. Remember that only the initial plan will use the intake date for certain sections of the plan. When you are using this function, copying a treatment plan, it should be for reauthorized youths. Meaning the youth has been authorized for another 12 weeks of in-home services. For a step-by-step guide to updating a copied treatment plan, review the Copy Treatment Plan training under Continuing Education Trainings here on Empower University LMS. Thank you for participating in this training session. Quiz requirement. Please ensure you complete the quiz with a score of 80% or higher. Retake policy. If you do not achieve an 80% on your first attempt, you will need to retake the training. Further support. After your second attempt, if needed, providers will be directed to the synchronous training support with the Education and Development Department to clarify any concepts that may be unclear. If you have any questions regarding the information presented, please contact us at the Education and Development email, educationanddevelopmenteU@gmail.com for further assistance. We are thrilled to welcome you to our team. It is an honor to have you join our dedicated providers working with families across the state of New Jersey.